We continue with treatment principles with another case history. Wait lang, Doc. Ano na po ulit. Our patient is a woman, age 35, with the following clinical manifestations. So prior to the initial consultation, this patient had had a very heavy cold with a congested chest, an occipital headache, and alternating feelings of heat and cold. When she came for the consultation, she complained of a feeling of exhaustion, alternating feelings of heat and cold, slight depression, a slight hypochondrial pain, and loose stools. Her pulse is wiry, and the tongue has a normal body color with thin white coating in the lung area. The diagnosis: this was originally an attack of exterior wind cold at the lesser yang stage. Now it is still at the lesser yang stage, but combined with greater yin stage. So to explain the diagnosis, the symptoms of the lesser yang pattern are alternating feeling of heat and cold, hypochondrial pain, slight depression, and a wiry pulse. The symptoms of the greater yin pattern are exhaustion and loose stools. Although this patient was seen 3 weeks after the onset, the pattern was still partially at the lesser yang stage, and the pulse was all important in the diagnosis. Since this was wiry and full, it indicated that the pattern was still primarily of an excess character, even though the patient felt very tired, which is a deficiency symptom. So for the treatment principle, since the pattern is still primarily of an excess nature and is characterized by the presence of a pathogenic factor, which is wind cold turned into heat at the lesser yang stage, the correct approach is to concentrate on expelling the pathogenic factor, even though the patient feels tired. When the pathogenic factor has been expelled, one can tonify the upright chi, in this case, the spleen chi. This was the plan of treatment adopted, and in the first treatment, triple burner 5, triple burner 6, and do 14 were needled with reducing method to clear heat and regulate the lesser yang. Reducing these points produced a nearly immediate and dramatic improvement, including the return of her energy. After reducing similar points again in the second treatment and the disappearance of the lesser yang symptoms, which is hypochondrial pain and wiry pulse, attention was diverted to tonifying the body's chi, reinforcing lung 9, spleen 6, stomach 36, and pericardium 6. This is an example of the principle of expelling a pathogenic factor first and tonifying the upright chi later. From the point of view of root and manifestation, the root is represented by the heat, which is half in the interior and half in the exterior, which is the lesser yang stage, producing the various clinical manifestations. In this case, only the root was treated, clearing all the clinical manifestations. Thank